One of our major goals in the stem cell transplantation program here at Children's is to become the world leader in innovative new clinical therapies. Right now, we perform extremely capable and effective clinical transplantation, and we do research in ways that look at improved methods for control of graft versus host disease and some of the complications of transplant. But the future is to expand transplant to diseases that we currently are too ineffective to treat. We here at Children's are working on protocols to offer transplantation to patients with non-malignant diseases, the diseases that we don't think are immediately fatal. So beyond leukemia and lymphoma, we're now talking about treating sickle cell anemia, thalassemia, diseases which threaten a lifetime of disability and pain but aren't immediately fatal. We have gotten so good at transplant that we now feel comfortable offering that to patients in an attempt to cure their disease. And think of the opportunity. We could take a child and instead of seeing them as a lifetime burden of pain and disability, instead we see them as cured. That changes a child's life and be enormously satisfying. Children's is also working on translating science that's been developed in our own laboratories into the transplants of the future. Scott Armstrong here has shown that there are particular combinations of drugs that can reverse resistance in certain very refractory and hard to treat forms of childhood leukemia. We're moving that scientific insight made in the laboratory into new patient protocols in transplant. And we hope it will become the wave of the future. My colleague Leonard Zahn, working in a fish, in a zebrafish model, has discovered a chemical which can expand blood stem cells and in mouse models of bone marrow transplant actually encourage engraftment, actually make the transplant work better. That, in just a period of 2 years, has gone from the laboratory to new clinical trials in transplantation. So we're seeing the beginning of what we think is an upsurge in new and exciting innovations around the stem cell transplantation program here at Children's.